Hi, Herman. Oh, okay.
Hello, sir. Yes, sir. It's early in the morning in the Philippines. It's actually 1 p.m. 1 a.m. I should say. So it's nice to meet you, sir. So,
Likewise. Nice to meet you as well.
yes, sir. It's 12 noon, or I should say 12 p.m. in the US in your time now.
That's right.
So
It's
thank
noon
you.
time.
Yeah, yes, sir. So thank you very much for our meeting for tonight, or in your time, it's 12 p.m. In my time, it's 1 a.m. in the Philippines. So I'm sure you are very familiar with Filipinos in the USA.
Oh, yes. We have lots of Filipinos. My favorite people, actually.
Oh, really? So that's nice to
My
hear from you.
favorite people in the whole world.
Yeah, so there are a lot of Filipinos actually in the US and all over the world. They are found everywhere. So we are very glad to have you tonight. And I'm humbled as the one who invited you to be our resources speaker for our webinar. And yeah, so I'm a social worker for Universal Care for Africa Foundation. And we're doing this to widen our knowledge along health, not only for ourselves, but this is also for our community workers who are related to UCA, who are actually serving the different countries associated with UCA. And these are the countries like Kenya, Nigeria, we have the Gambia, Sierra Leone, among the 6 countries. Okay,
Fabulous.
so
Now, have you been there?
no, it's only through the net now that I came to know about the organization, and because I find it very interesting. Not only that, but it's also very related to my profession as a social worker, and so I get the chance to be connected with the organization. So from then on, I was an active, so to speak, relating people to this organization at along these webinars, along healthcare themes. And I learned to I learned about you, sir, because I've been following you at LinkedIn, and I got the courage. It was very courageous on my part now to have invited you, and I'm so humbled that you also have given us the chance to be with us for tonight. And having read your very nice and very great resume, so I'm so humbled, and even our team members at UCA. And I was telling them we've got a very great and a caliber physician for tonight in our webinar, which is our topic on integrative medicine. Yes,
Well,
sir.
thank you for the invite, and not at all. I've been looking forward to this and really looking forward to working with you all. So, are you a volunteer, or all of you volunteers, or are you a paid employee of the organization?
No, sir. I'm a volunteer social worker for UCA. So
Got
UCA is Universal Care for Africa
right.
Foundation. And actually, the CEO is from USA too. He lives in St. Louis, but he's from the Gambia.
Right.
Yeah,
Okay.
yeah. So he's now in the US. They have immigrated to the US. I also have relatives actually in Maryland, and
Oh,
also
very
in,
nice. Okay.
yeah,
Have you
I have
been?
no, not in the US. Maybe in the future I can go to the US.
We have to get you
But
some traveling.
yeah, but I was one time in New Zealand, also in Ireland for some work and research presentations along social work.
Very good. Very good. Well, like I said, it's a pleasure to finally speak to you in person.
Yes, sir. I hope so. I hope to. Yeah. So we welcome all of you. So I would like to know how many among your friends here or coworkers who are with us tonight for this
Um,
time.
yeah, we have quite a number actually, and
Oh, really?
Yeah, if you look at the Zoom, there's quite a number of my colleagues are here and friends, and I'm not sure. I guess other participants will be on Facebook, so we won't know.
Yeah, so actually, we have,
ما فيرن هو بحا بحا هو فيرن
oh, I lost my,
إيرد بالإيرد والله ما
okay, I'm sorry.
That's okay. Are we still waiting for Mariko or?
Yeah, Mariko is actually with us, sir. So, um, I welcome you all. Wait, I lost my connection.
Yeah, your video is going in and out a little bit.
Okay, I'm sorry.
That's
Okay,
okay.
so we have Mariko here. Mariko, I would like to introduce to you our guest speaker from Philadelphia, USA. So I think we can now begin. I would like to read our resume for our resource speaker, and I'm so overwhelmed with the one I got from LinkedIn. So please allow me to introduce our resource speaker for this webinar. I hope to. How do you pronounce your name, sir? Sorry for that.
Babar Gari.
Okay, Baber Gori. So I made the right guess.
Mhm.
Okay, so we have ladies and gentlemen. It's early morning in the Philippines. It's 12 past 12 noon in Philadelphia, USA, and it's past 8 p.m. also in Africa time. So welcome to you all. I would like to introduce to you our resource speaker, no other than Dr. Baber Gori. He is the President and Chief Executive Officer of Salus Integrative Health from January 2019 to present. He is a clinical assistant professor of medicine, College of Medicine at Drexel University from November 2006 to present. He is also Chief Medical Officer of Upright VR. VR stands for Virtual Reality from October 2018 to present. Among his licenses and certifications, he is a fellow of the American College of Physicians, FACP, and among his licenses, we have he is a licensed physician among Integrative Medicine. This was issued by the American Board of Integrative Holistic Medicine on October 2014 with no expiration date. Another license issued to our resource speaker is he is a license in clinical informatics, also issued by the American Board of Preventive Medicine on January 2015 with no expiration date. He is known for volunteering work. In fact, he is a trustee at Community Options Enterprises from May 2011 to present. He is proficient in Arabic. This is one of the nicest data that I got from your resume, sir. You are proficient in Arabic, and of course, you are proficient so much in English, and I'm sure you have other languages too. Ladies and gentlemen, uh, a leader, a healthcare innovator, an educator, ladies and gentlemen, we have for tonight or for this early morning in our time, Dr. Badergori. Welcome, sir. I also would like to welcome your friends and your coworkers, or how do you call them? Your friends.
Oh, friends. They're all friends first.
So thank you very much for being with us, and I welcome you all.
Well, thank you, Herminia, for such a gracious introduction. I do have some slides, but I'm not able to share my screen. Looks like it's disabled. I can go without them or with them. Are you controlling the Zoom or is somebody else?
It's Mariko, sir, who is controlling the Zoom.
Okay, so Mariko, do
Yeah.
you want me to use the slides or no?
You just go on, sir, with the slides, and at the same time, we can
Okay,
have.
no. He enabled it here actually, so I can do it.
Okay, sir. Thank you very
All
much.
right.
Hello, Hermania.
Yeah.
Yeah, I'm
So
getting it.
we.
It is Ibrahim. I think Marco is little bit busy. We can officially start the program.
Okay. Okay. No. Later on, we will move on to that. So, our guest lecturer now is starting his presentation.
Okay, I'm back. All right, let me share my screen here. Okay, can you see me?
Yes, sir.
All
Yes,
right,
we can see.
perfect. All right, let me. Okay, well, the most important message that I'm gonna give you today is on the screen already. So you already got your money's worth, I think. Love is the most powerful healing force in the universe. If nothing else, please remember this. This is our event for today and the title of our little talk today. And by the way, do I have 45 minutes or an hour? How much time do I have?
Okay. Based on our invitation, sir, so we can have the most is 2 hours. So we have 1.5 hours to 2 hours.
Okay.
So long as including the open forum or the question and answer portion after you shall have given your topic shares.
Okay, great. And then should I do question and answer throughout or just at the end?
Yeah, we are
Uh,
at the middle of our discussion. If there are questions, sir, then we would be glad if you can also
Yeah,
entertain
yeah.
us. Yeah,
I'm happy
yes,
to,
sir.
with 2 hours, that's a very long time. So anybody that has a
oh,
question is welcome to ask.
it's okay. You can ask. Other start point you can also ask. And the
Yes,
long
yes,
hour
yes.
is almost 2 hours. You can also do it one half hour. It's okay.
Yeah. So that's fine. So I would
Thank you,
ask
sir.
anybody that has a question to either raise their hand or put the question in the chat
Yeah.
and
But
maybe.
for if I would like to tell the people, if there is question, you should raise your hand in order to keep the order of precedent. So it's a request.
That's great. And
So
then,
Okay.
if
saar wallaahi bilaahi tallaahi ani inta i fiiriso adna isku noqaan dhahay
so sorry that you can start now.
okay, great. And Mariko, can they use the chat to ask questions as well, or just raise hand?
Yes, sir.
Okay, very good. So again, thank you, Mariko. Thank you, Herminia, for inviting me today. I'm really excited to present this brief set of information to you all. There's not going to be a lot of data today. It's just going to be a lot of very high level conversation. I understand you're trying to change the way you deliver healthcare in all of these countries in the eastern part of our world. The title of today's presentation is Within Normal Limits, Why Solution. And just starting out a little bit about me, Herminia, you did such a nice job talking about all of my kind of various roles, but really at the end of the day, I'm a husband, I'm a father, I'm a son, I'm a brother. That to me is the most important thing that I do. I'm also a practicing physician and an educator. I have a lot of experience in healthcare administration, serving as an executive in a number of different um, environments, including large health system, hospital, pharmaceuticals, and various other organizations. I've had a very, very privileged career to work in pretty much every healthcare environment that an internist can work in. I've done quite a bit of innovation as well, which is probably one of the most fun things that I do. And my technology background is how I've been enabled to participate and contribute the way I have throughout my career. And these are some of the organizations that I currently work with or have had in the past. The health system that I worked for before is Trinity Health. That's a very, very large health system. We had about 100 hospitals when I was there. And then some of these other logos are just for the kind of places where I came. This is my organization, Salus. So these top three companies here are some of the enterprise, part of the enterprise that we're building in integrative health. And we'll talk more about that as we move on. So this is what we're going to talk about today. We're going to do a very brief history of medicine and kind of how we got to our current state. We'll talk about integrative medicine and what it is and why we do it and why we think it's the solution. And then we have to talk about COVID-19. I mean, that's part of the reason why there's such a need for a change in the way we deliver care now. So starting with our history, how did we get here? And why are we also burnt out? Especially in America, I mean, throughout the world, but especially in America, our doctors and nurses and all of our people, our pharmacists, they're all burnt out. They're all really tired. It's been grueling this past 5 years or so, and especially last year has been extremely difficult. It's been very concerning also because our rate of suicide is highest in physicians among all professionals. And that's a huge problem that we're still dealing with, and it's actually getting worse. We think COVID is partly to blame in the recent worsening. So we'll talk a little bit about that. And so how did we get here? Why are we in this position? And it's because we know already, right? We have this pill popping culture, right? So how did this happen? So, and again, this is my opinion. A lot of other people might agree with this, but there are other theories for how this happened. But in the 40s, up until the 40s, we didn't really have a lot of pills. What was out in the market was herbs and different types of concoctions. Most didn't have any type of evidence, like formal literature or anything supporting it. And people just had remedies that they used. Some of them were passed down over many generations, and some weren't. What happened in the 40s that was very significant was something called penicillin, which I'm sure you've heard of. Actually, it was benzathine penicillin, which is an IM injection, and it had obviously changed the way we deliver care. And so, to give you an example, at that time, if you got syphilis, which is a sexually transmitted disease, that was a death sentence. You were going to die. Syphilis was not something that was going to, your body was going to be able to handle by itself. But with the advent of benzathine penicillin, all of a sudden now, if you have syphilis, you get one shot and you're cured. No more syphilis. And so that was a huge deal and really started to change the way that we deliver care in the US. The pharmaceutical industry really took off. I mean, it was already building up. And at that point, they made a lot of money from benzathine penicillin, as you can imagine. And the key and the investors all said, well, you have penicillin, what else do you have, right? And so quite a bit of research, and basically our entire system that was the birth of our entire system. And since then, obviously now, where 70% of all Americans are on some type of a prescription medication, we are absolutely a pill popping culture. And throughout those years, I guess it's 80 years now, we've developed more and more pills. And one of the problems has been that these pills have been the people that have been allowed to prescribe these pills are very special, and they're called doctors, right? So this whole system of care delivery was managed by doctors. And so only the doctors were able to prescribe these medications, and they went through very special training to be able to do that. And prior to that, the number of conditions that you could treat. So, for example, in the 40s, when penicillin was released, it only treated, maybe 15 or 20 different infections, right? So if you had strep, or if you had staph, or if you had syphilis, or if there were quite a number of other bugs, it was a very limited amount of diagnoses, especially in the 40s, and obviously over time that increased. And compared with 2021, I should say, the number of diagnoses is almost infinite. I mean, there are entire code sets. So you've probably heard of ICD-10. ICD-10 is a system of nomenclature that describes different diagnoses. There are 180,000 codes in the ICD-10. And so that's very different than the 10, 15, 20 diagnoses that we had in the 40s, right? And that's because we can treat a lot of those things. We're very good at treating now. So this slide is meant to just highlight the idea that the only ones that were trained or qualified to write prescriptions were physicians, and physicians oversaw themselves. And over time, especially in the 70s and 80s, when we had a bit of an explosion in the number of pills there were for the number of diagnoses, physicians were cowboys. We were able to do kind of whatever we wanted to do. If we thought something was right, we did it, and whether it was right or not, right? And that's why it's a practice of medicine. And me too. I started my practice in the 2000s, and even up until then, I had a lot of autonomy in what I did, and that autonomy has been reduced quite a bit, but it's still a lot. It's still quite a bit of autonomy I have. And we'll talk more about autonomy and how the standard of care influences the way we practice. So moving on then. So if we're cowboys and we're doing whatever we want, why are we so upset? Why are we so burnt out and frustrated with the system? And that is because of the complexity of medicine. As I've said earlier, the number of diagnoses has exponentially increased since the 40s. And each diagnosis, and now that we have so much technology, we not only do we know the diagnosis, but we also know how and why, and we know all the physiology. We have almost infinite amount of knowledge on quite a number of different diagnoses, and that complexity becomes very hard. So what happened in the 80s is that we started having specialists, right? So in the beginning, in the 50s, 60s, 70s, you were a doctor and done. That there was one or two types of doctors. There were psychiatrists, there were primary doctors, and then there were surgeons, right? 3 or 4 different types of doctors. But in 2021, we probably have over 100 different types of doctors, from gastroenterologists to cardiothoracic surgeons to electrophysiologists, and I'm sure all of you are well versed in all the different specialists if you've been in the healthcare system at all. And that's because of the complexity. So now, because no one person can know everything, right? So all of us are a team, and we rely on each other to help each other take care of the patient. And so this complexity has been really the main reason why we've all specialized in our individual specialties. So the next part of this story is in terms of the quality of care. So I have a poll. I won't ask you to actually take a poll, but the question is, which of the following is the best predictor of clinical quality, right? And there's lots of options here: number of years in practice, personal character, level of compensation, what medical school you went to, what residency you went to, how many RVUs, which is a measure of production, do you do in a month, your scores, your medical school GPA, what kind of car you drive, how much vacation do you take a year, which of these is most correlated with quality? And then the last one is level of passion, right? So when I do this in a public forum, I have everybody vote and raise their hand and pick And people pick all over the place, right? A lot of people pick number 6, a lot of people pick number 9. But actually, the answer is access to information, which I'm sorry I didn't include on the previous slide, but that was on purpose. So it turns out that the best quality and the best care quality is given by the people that have the best access to information, right? So what does that mean? That means that I don't need to go to Harvard. I don't need to, be the best student in the class. I mean, obviously that helps. If I have access to information, if I have access to knowledge, I'm going to deliver great care. And this was a very big deal. So especially, in the 90s and in the 2000s when I was starting my practice, there was a little thing called the internet, right? So the internet obviously changed the whole world. And the advent of the internet is why a lot of people that were specialists, even subspecialized even more, because now they have even more access. And again, there's a limited amount of information that any one person can know. So now we know literally exponentially more information than we did the day before. As a matter of fact, it's been shown that the amount of data that's on the internet, the amount of information that's on the internet doubles every year. So however much information we have this year, next year it will be double. And the year after that, it'll be doubled again, right? So that's an exponential increase in the amount of information. And so, as I said before, no one can know all this. No one can know everything. And the average patient, especially in the US, we're very sick people. Our culture is a very sick culture. We have lots of different conditions. We have diagnoses. And as I said earlier, 66%, or I like to round up to 70% of all of our people are on some medication. That means they have a diagnosis. So all of these different diagnoses have all of these different specialists, and there are very few people that are being managed by one doctor, right? I mean, a primary care doctor, for example, typically will be seeing a patient and managing all of the input that he or she is getting from specialists. So all the different specialists are, communicating. Ideally, they're communicating with the primary care doctor, um, and that primary care doctor is trying to deliver the care to the patient. But unfortunately, it's a very fragmented system, and we're doing the best we can to fix it. But a lot of people call our healthcare system a sick care system because we take care of people that are sick. We don't really help people be healthy. And that's been a very big and very fair criticism. So before I move on, are there any questions about anything that I've said in this section?
Okay, so we heard you speak about the difference between sick care system, sir, versus healthcare system. Would you mind to further on that, please?
Absolutely, yeah. So we're going to talk a lot about a healthcare system in the next section. And when do we go see the doctor in the US? Primarily when we're sick, right? I mean, most of the time, most people who are feeling well, and we have a couple of people on this call right now who are young people. They generally don't go to the doctor. If you talk to them, they'll say, "Oh, when's the last time you saw the doctor? 5 years ago, 10 years ago, right?" And why did you go then? Because you were sick. You had flu or sore throat or whatever, broken arm. And so our entire system is built like that. That people don't go see the physician until they have an issue. And unfortunately, for chronic disease, which 25% of our people are using 75% of our healthcare resources because they have chronic disease. And so these chronic disease people, when they don't go see the doctor, they get into more trouble. And unfortunately, some of them do see the doctor, and the doctors don't know how to prevent chronic disease. And so that's not a healthcare system, right? That's a sick care system that only takes care of patients that are sick. Did I answer your question, Herminia?
Yes, sir. Thank you very much.
Okay, if there are no others, I'll move on.
Yes, sir.
So the
Please
next,
move on.
yeah, so the next section is what I like to think is the answer to all of these problems. And that's integrative medicine. So I have to speak a little bit about my own history with this. So in 2010, I had been about 10 years into medical practice. And just like many other people, I started looking around and wondering why my patients, I mean, I took good care of them. I did what I was supposed to do for them. And I'm primarily in the hospital. So we would take care of these patients and discharge them, and they would come back. They would come back a week later, a month later, 6 months later, with the same problem or a worse problem. We really weren't helping anybody. I wasn't helping anybody. It was very frustrating because I thought I was a good doctor. I thought I was delivering good care. But again, I was delivering sick care. And what I wasn't doing with patients was I wasn't talking about why they kept getting sick over and over and over again. I just kept giving them pills because we have a pill popping culture, right? So started looking around, started wondering that there must be a better way than what we're doing right now with all these pills. You just keep putting people on more pills and more pills every time they come in. Now they're having side effects to the pills that they're on, and now we're giving them pills for the side effects. So it's been that was very eye-opening, and so we discovered this thing called integrative medicine. And what integrative medicine is, we'll talk about the definition, um, is a system of care where we're looking at the patient as a whole, as opposed to allopathic medicine, which is where I was, my medical school as an MD, I learned about allopathic medicine. And in allopathic medicine, we're really looking at the disease or the problem as something that we need to fight against. It's an opposition to philosophy of care. So for example, if I have a bug, if I have an infection, I'm going to give you an antibiotic to kill the infection. Contrast that with homeopathy, right? Homeopathy is another type of medicine where the theory is to actually augment the body to take care of the problem. So if you have an infection and you're going to a homeopathic physician, the homeopathic physician will give you either another infection or a little bit more of the same infection to spur an immunologic response to it. And although that can be controversial, this is the way people were, getting care, prior to the rise of allopathic medicine. And so homeopathic medicine is just one of many, many, many types. So you might ask, what are these different types? And let me just skip to that for a second. So here are some, functional medicine, naturopathic medicine, osteopathic, holistic, regenerative. And then what I like, and the way I define all of this, all of these are integrative practices. So because integrative practices are inclusive of anything that has evidence, right? So, and diving a little bit deeper, integrative medicine is what I like to call mind, body, soul, or mind, body, spirit medicine, where we're looking at, three components of a person's health. Whereas as an allopathic physician, I really was just focused on body. And if somebody had a mental type of an issue or an emotional type of issue, I would send them to the psychiatrist, right? I wouldn't address that. And in my view, that's not good care. That's wrong. I was trained to do that, and my training was wrong. By the way, I paid a lot of money for that training too. But that's okay, so I learned later anyway. So integrative medicine is a mind, body, soul approach to a patient's health. And we'll talk more about, what does that actually mean? So whereas in the past, a patient would come to me and say, I'm having really bad breath and I'm having this burning, in my throat and in my chest. And very often my chest is hurting. So I would talk to the patient. Most of you on the call probably know what that is. That's called gastroesophageal reflux disease, GERD. We have pet names for everything. And the treatment for GERD is proton pump inhibitors, which is a prescription medication. And what ends up happening is that you're only supposed to go on the proton pump inhibitor for 3 months, and then you're supposed to be better after that, because you're supposed to stop doing the offensive behavior that causes it, right? What do you think that offensive behavior is? The offensive behavior is the food that we're eating, right? So if we're eating, you guys don't know maybe what a cheesesteak is, but a cheesesteak in America is a very delicious, greasy thing that can cause GERD. It's not good for you. It's not the best food that you can eat. And we have lots of foods like that: pizza, hot dogs, hamburgers, all my favorites, French fries. All these things can cause reflux. And what we don't do in American health is that we don't address that root cause. And that's really, at the end of the day, to me, that's what integrative medicine is about. I like to call it root cause medicine. Is that why are we giving people these proton pump inhibitors, these pills, and not addressing the root cause of the problem, right? Because if we address the root cause, guess what? You don't need the pills, right? If I'm not eating hot dogs and hamburgers and cheesesteaks, I won't have reflux. And unfortunately, we don't think like that. As an allopathic physician, I wasn't trained to think like that. I was trained to treat, which is not a bad thing. You want to help people. And I was not really trained to look at the root cause. So this little diagram, is a nice way to look at symptoms, right? So this is what people come in with. Patients come in, they say, oh, I have memory loss, or I have decrease in energy, or my sleep is messed up, or my immunity, I keep getting infections. And we look at that and we try to make a diagnosis and get to the root cause, but we're not really focused on it. We're not asking the right questions. We're asking about medical and body questions. We're not asking about mind and spirit. We're not asking, oh, I had a very close family member die last week. I had, I lost my job, or so many other factors that can affect health. And so these factors are what we try to look at when we talk about root causes. Some of the examples of these are common examples of root causes. So immune imbalances, structural imbalances, inflammation. So inflammatory imbalances is a huge reason for medical issues. So and inflammatory imbalances primarily are from food, your diet. And an inflammatory diet, like for example cheesesteaks, right? So meat, especially meat that has been treated with hormones and antibiotics, is very inflammatory to your body. And so an increase in inflammation in your body overall can exacerbate underlying issues, like for example arthritis, right? And people think that, oh, it's we have a lot of hip replacements in America. A lot of people who are older, especially, they need hip replacements. And even me, I'm a doctor. I didn't know until 4 or 5 years ago that it's actually cholesterol. High cholesterol actually leads you to needing your hip replaced, not usage, is what I thought. Over usage is what I was always trained is the reason why, eventually your hip joint or your knee joint will be worn out because you're using it, if you're a runner or if you're an athlete. And that's not wrong. I mean, that's true. But that's not the most common. The most common are people who have high cholesterol. And so these high cholesterol people who are also obese, right? It's been shown that they overuse their joints, but because of their hypercholesterolemia, they're not able to repair their joints as quickly as someone that has normal cholesterol, and they eventually will wear out their joint, right? So the root cause is not running. The root cause is your diet. The root cause is your cholesterol level, right? And so most doctors don't know that, and that's a big deal. That's a big problem because we're prescribing medications and we're doing surgeries and we're doing all these things and we're not really addressing the root cause, right? But guess what? We're getting paid, right? These surgeries are not cheap. We get paid a lot of money to do these surgeries. I get paid a lot of money to see these patients. And unfortunately, our health system is a huge moneymaker in America. It's the number 2 GDP, gross domestic product, only behind energy. Energy is number 1. And so there are a lot of people working in healthcare in various capacities that make a lot of money, right? So because everybody's sick, right? So if we all of a sudden went from 70% of people on medications to 10% of people on medications, that's a lot of people that are going to lose their jobs. That's a lot of people that are going to look for work and not have a livelihood. So the way we fix our health system has to account for that. Not that we should slow down, but we do need to pay attention to the idea that there are quite a number of people that are employed in the healthcare system. And President Obama back in 2008, he passed the Obamacare Act, which tried to create universal health for everybody. And although this was bad for doctors, I still endorsed his idea because I really believed at that time that health was a right and not a privilege. And so I didn't mind paying the extra taxes. I didn't mind doing the extra work so that everybody could have healthcare. But the problem is back then I did not understand this root cause idea, right? And so there's not enough doctors, there's not enough healthcare staff. We're already the number 2 leading industry, in the country, and we're not doing a good job taking care of our people. Our people are the sickest people on the planet. We're the number 30 on the rank list of quality healthcare, right? Between now we're a little bit better. So, we range between 15 and 35 on where we are on the list. But why aren't we number 1? We should be, right? When I was growing up, I was told that we're number 1. And we are number 1 in certain specific areas, right? And we can talk about that at another time. But we're not number 1 overall. Our people are very sick, and our doctors and nurses and pharmacists, we all mean well. We're not trying to hurt anybody. We're not trying to profit from, anybody's disease, but we are profiting. And none of us really want to do that. So this is a very, very difficult problem. But the answer is addressing the root cause. I mean, if we keep treating symptoms and not addressing the root cause, this is just going to get worse, like it has. I mean, we have literally 80 years of this experience. So you don't need to be rocket scientists to understand that root cause is the way to take care of patients. All right, so let me pause there for a second. Are there any questions about anything that I've said about root cause or what integrative medicine is?
Okay, sir. So we heard you speak about the root cause medicine and um, its difference from the one that you were trained about when you were still studying medicine. You were speaking about allopathic medicine, the use of pills to address the different diseases of people. And we are getting to the very core of our topic for this webinar. So we would like to learn more about how we can bring in now the spirit and the mind. No,
Yes,
because allopathic, so to speak, was very focused on the diseases of the body.
correct.
So along with the issue of the kind of diet that most of the Americans have been into. So I was just wondering, like, if you were to compare now, like the diet of the Americans, which one can we benchmark with, like countries that are going urban or foods that are going natural foods, organic foods, something like that?
Yeah.
Yeah, because also I was thinking about the issue of lifestyle, the issue of lifestyle, like people have to hurry going to work, and they have to pack all these foods ready to go, something like that, sir. Can you
Correct.
enlighten us further? Yeah.
No question. So we're absolutely going to be talking about that, but we can talk about it now.
Okay.
Diet and lifestyle. I mean, that is the answer. That is the solution. And so, as I said earlier, we have a sick care system where you only see the doctor when you're sick. But the truth is, we need a healthcare system. And right now, the food industry, which is a huge industry, very, very, very big, as you can imagine, is completely separate from healthcare, right? But the truth is, it is health. What you put into your body is health. And the food industry and the health industry really need to be united. My feeling is that the health industry should be overseeing the food industry, but maybe I'm biased. It doesn't really matter one way or the other. These industries need to be combined because the food that we're putting into our body, maybe more than anything else, maybe even more than lifestyle, is what's causing a very, very large number of our chronic diseases. So when you talk about diabetes and you talk about um, hypertension, and pretty much everything. I mean, obesity, obviously. So all of these very, very common conditions are because of the way we eat, and also because of our sedentary lifestyle, right? But the thing is, if you don't put it in, right? I mean, look at the continent of Africa, right? So there are lots of countries there where they um, don't have a sedentary lifestyle, and but they don't have food, right? So because they're not putting in cheesesteaks, right? They're not eating cheesesteaks. They're not eating Whoppers and Big Macs and French fries. There's nothing to take off. So even if they had a sedentary lifestyle, it wouldn't be, it's not such a bad thing. You do need to be active, obviously. Um, but it's the food, to me, that's number one. Because if you don't put the bad food in, you don't have to take it off. You don't have to worry about it. If you're putting only good food in the first place, your health is going to be that much better and that much easier to manage. And so we'll talk more about diet and lifestyle, but there's actually an entire discipline now, lifestyle medicine. I was talking about this different specialties.
Lifestyle
So
medicine.
integrative medicine is one specialty, but lifestyle medicine is a parallel specialty, which really just focused on exactly what we just talked about, diet and lifestyle. It's really the same. I mean, they don't, the lifestyle people don't go so much into some of these things that are on this slide. These are different, I call them modalities, but these are all the different integrative options in addition to, your typical pharmaceuticals and your allopathic, medicine. You have holistic medicine and nutritional supplements, natural medicines, and naturopathy, right? So that's a whole nother degree actually in the US. It's called ND. Instead of an MD, you can get an ND, which is a naturopathic doctor. Um, and then there's also osteopathic, which is a DO. MD is allopathic. And so all of these different specialties and all of these different modalities, these are all integrative, all of them. If you have evidence, right, in integrative practice, if you have evidence, we're going to use you, right? And so there are so many of these, right? And it's a shame that in my medical school, I paid a lot of money for my medical school, almost $300,000, and I didn't learn about any of these. I just learned about pharmaceuticals, and I learned a little bit about surgery, but primarily pharmaceuticals. And what was the point of that, right? It's actually very angering. It's very frustrating to learn later, after you've paid for all your education and training, and learning that, look, I have 100 other modalities to learn about now if I want to take good care of patients. And that's okay. That's what we've done, right? That's what I've done. I've gotten board certified in integrative medicine, and obviously learning all the time. But the biggest opportunity, if we had to just choose one, right? The biggest opportunity for me, it's not on the slide set, but I'll just talk about it, is the microbiome. Um, the microbiome, for people that don't know what that is actually the largest organ in your body. And it is made up of viruses and bacteria primarily. I mean, there are other things, fungus is another, but it's normal to have bacteria and viruses in your body. Completely normal. As a matter of fact, we have 80 trillion viruses in our body, every one of us. We have 30 trillion bacteria in our body. And when you look at the DNA, so all the DNA that's in your body, right? If you think about it, there are human cells, there are bacterial cells, there are viral pathogens. If you count up all the DNA, the amount of DNA that's actually in your body is 1% you and 99% other things. So are you really who you say you are, right? I mean, you kind of have to think about that. So anyway, I'm digressing a little bit here, but the microbiome is a very, very important organ in your body. It's extremely important, especially in digestion and immunologic function. And when you think about COVID, it's very, very common. You put on the news, and we'll talk about this later more, but why does America have so much COVID? Because we're not very healthy. We're sick. And our microbiome is completely whacked up. It's, our microbiome is the biggest opportunity for us to improve our own health. And the foods that we're eating are the reason, right? So especially when we're eating the chemicals, the second part of the microbiome kind of story is two things: gluten, and GMO foods, right? So that's glyphosate. So GMO foods, genetically modified organisms, are treated or are designed, they're engineered so that when you spray glyphosate, which is Roundup, Roundup is the brand name of this poison that you can spray on a plant. So GMO plants are not affected by the Roundup. So guess who makes the GMO plants? The same people that make Roundup. So it's a very, very big business. And the company is Monsanto. They've been doing this since the 80s. And so this is a very, very difficult problem because we know for a fact that glyphosate causes disease. As a matter of fact, there were quite a number of cases in the past 3 or 4 years of individual patients suing Monsanto successfully, not for a little bit of money, for $120 million, $60 million, $30 million. And Monsanto is just playing these cases. And guess what? Roundup is still on the shelves, and we're still using Roundup in our agriculture, despite the fact that people have successfully sued this company for its use and for its role in developing or causing cancer, lymphoma, in patients. So that should give you an idea of how complicated this problem is and how difficult it is, that we know that a certain chemical is causing cancer in our people, yet we're still using it. And so, and I know in Africa and even in the Philippines, I mean, the politics is a really important part of, the way we're going to have to change our healthcare system if we want it to be better. A lot of it is political, unfortunately. I'm not an expert on the politics of it, but I have learned, and when we talk about COVID, I'll share some of my learnings with you on some of the politics of how and why things are the way they are and what we might be able to do to fix it. Let me stop here for a second. Are there any questions about the different modalities and how they relate to the overall practice of integrative? We're going to go a little bit deeper into this on the next couple of slides.
Yeah, not now. So you spoke about DNA. I might be going ahead like RNA, the DNA, and then we have the RNA, sir.
Yes. So yeah, so since why don't we save that for the COVID? Because when we talk about the
Yeah.
vaccine, we can talk about RNA and
Okay.
DNA.
Okay. So,
We'll give you a little bit of a biology lesson then.
yeah.
So let me go
So
into some of the questions that you had asked about integrative. So some of my favorite modalities, number one is yoga. And I'm a closet athlete. I like to play basketball. I like to play tennis. I like to play hockey. I've played these sports throughout my life. And if you would have asked me 10 years ago, why don't you do some yoga? I would have laughed at you. I would have said, you're crazy. That's for, number one, that's for women. And number two, how is that even exercise? That's what I would have said. And I was stupid. Yoga, I do yoga now, and I do 20 minutes of yoga, and it's almost like I played basketball for 2 hours. I mean, it's an incredible option for health and for exercise. And there are so many different kinds of yoga, but yoga can be used therapeutically. Matter of fact, just yesterday, we had a family member over that was having some hip issues. He told me he spent $2,000 on his physical therapy, and still not better. He's been doing this now for 3 months. And I told him he needs to start doing yoga. And I told him within 2 to 4 weeks, he's going to be completely healed. Because I know that's what's going to happen, because we've done this 1,000 times with other patients. And yoga is not free, but it's pretty close to free. It can be free if you use YouTube, but if you get a proper class, it might cost a couple $100, for 3 or 4 months, of training. And so you can start to understand the problem there, right? So now you have a $2,000 therapy that doesn't really work that well. You have to do a lot of it if it ever works. So if my friend does, physical therapy for 6 months, he's going to end up paying $6,000, right? But if he does yoga for 4 weeks, that's going to be a $300 or $400 problem, right? And he's going to be cured, right? Because yoga is going to address the root cause of his problem, which is that he's not really addressing his whole body. When he does physical therapy, he's focusing on his hip. And that's not bad, that's a good thing. But you can't just focus on the hip. Your whole body has to compensate for whatever's going on in your hip, right? So that's one of the reasons why yoga is such an effective therapy. And there's something about yoga that now I've been doing it for 3 or 4 years, and I know there are people on this call that are experts in yoga. When I first started doing it, it was just like this exercise that I did, and it was, I loved it. It's like the amount of agility that I gained from doing it and the strength that I gained from doing it was all great. But now, after understanding it and studying the different types of yoga, it's a spiritual experience. When I do it, I have a connection with something else, outside of the world. You can say it's God, while I'm doing it, and it's incredible. It's something that I didn't ever think that would happen to me, but it is. So it is definitely a spiritual exercise. It's a spiritual way of moving your body, and again, you won't know until you try it. Moving on, I love another thing called transcendental meditation. So that's this little image down here. So this woman is doing TM, and the reason why there are lots of different kinds of meditation, but TM to me is very special because it has a huge amount of evidence. In America, we have the American Heart Association, which is a very, very important and big organization for cardiologists and really anybody that's interested in heart care. And TM has incredible evidence of reducing blood pressure. And the American Heart Association has a scientific paper that says that all patients with prehypertension and stage 1 hypertension should try transcendental meditation first before they try anything else. And when I saw that, my eyes popped out of my head because I saw that about 6 or 7 years ago, and I didn't know that. And so I said, well, maybe I'm dumb. Maybe I just don't know. So I took the paper and I walked around my hospital. I met with 10 different doctors that were just walking, rounding on their patients. And I asked them 2 questions. I said, do you know what transcendental meditation is? Only 3 people said they knew. And number 2 was, did you know that the American Heart Association says that we should be using this first line for hypertension? And 0 of those people knew that that was the case. These are cardiologists and internists that I'm asking. That's a huge problem, right? And so if you think about it, well, why? Why did this happen? When I go on when a patient comes in, right, and they say, they're having headaches or something, and we check their blood pressure, and their blood pressure is high, okay? Usually we check it on 3 different visits, where that's the official guideline, right? Typically we don't. We might check it on 2 visits. The best of us checks it on 3 visits. So let's say it's the 3rd visit. The next thing we do is we write them a pill. We write them a hypertension medication. And by the way, that's the most common medication in the hospital. So anyone that's admitted to the hospital, they will have a hypertensive medication before anything else. It's a very, very common pill. And that pill costs about between $300 and $500 a year. And if you add in the cost of the physician and the cost of the echocardiogram and the EKGs, you're talking about $1,200 to $1,500 a year to take care of this problem called hypertension, high blood pressure. If you start with blood pressure at 50, you're going to live till 70 or 80. That's 30 years, $1,500 a year, right? You can start to see that's a $500,000 problem times 330 million people. So, it's a $500,000 problem for a lifetime for one person times so many people that get this problem. And now you're starting to understand, some of the reasons for why we practice like this. It's very lucrative. It's a money-making machine. And there's another reason, right? So that conversation with that patient is 10 seconds long. Oh, your blood pressure is elevated? Okay, here's a prescription for, atenolol or lisinopril or 5 million other blood pressure medicines, and that's it. They're gone. And now they're coming back every month or every 3 months or maybe at least twice a year or once a year, forever, for the rest of their lives. So I just guaranteed my income for the rest of that patient's life, as opposed to a 30-minute conversation about transcendental meditation where they go home and they never come back. What would you do? Right? And again, I'm not saying that you're, that we're unscrupulous or we're nefarious, because the guidelines say that we should treat hypertension with pills. And this scientific paper is not part of the guidelines. It's a scientific paper. So, and then the insurance company will not give me a bonus if I don't follow the guidelines. So you start to see the problems and you start to see the complexity of our healthcare system and the conundrum that our physicians have. They have to kind of choose between, number one, they have to know, which is the biggest problem. Most people don't even know the transcendental meditation, as I did with my little survey I showed you, I talked about earlier. So knowing is number one, right? So number two is, okay, if you know, then you kind of have to figure out, what kind of practice do you want to have? Do you want to have a practice with no patients, or do you want to have a practice with a whole lot of patients that come every month? And so you start to understand the complexities of this. So moving on, I'm not going to go into these others. So biofeedback is another example of an integrative treatment. It's basically you're learning how to control biologic processes like your heart rate and your blood pressure and what's going on in your mind. You're having stressful thoughts. How do you? Did somebody have a question?
Yeah, yeah.
Go ahead.
Ibrahim, do you have question, Ibrahim?
Yeah. So, Allah question you. Well, we love people when you. So if there's question, so their hand. My question is that is effective mid infant.
I'm sorry, sir. I'm having a very hard time understanding. Germany, did you understand the question?
Please, can you just write your question, Ibrahim? If
Yeah, can you hear me now?
is not good now, so please just, I think, write your question, and we will answer
Yeah,
that later, please.
question is that is accurate if it's paid.
I'm sorry, Ibrahim. I'm having a hard time hearing you. I apologize for that.
Okay, Ibrahim, we will have your question later on, or you can just write, you put that in the chat box and I shall read it later. And because you're having a signal problem.
Yeah, that's okay. If you put your question in the chat box, no question will answer it. Okay. And then just moving on with this slide here, I talked about biofeedback briefly, and also virtual reality. So Herminia mentioned that I'm a part of a company called Upright VR, and what we do there is incredible technology, and it's integrative. It's an integrative treatment because we are treating balance. So people that have balance issues. And what we do is we right now, when you assess balance, balance is assessed clinically, meaning that a patient comes in and we look at them, we do a few things with the physical examination, and we say yes or no, patient has a balance problem. There's no objective measurement, of that balance problem. They could go home and fall down. They could go home and, have a serious accident. There's no good way for us to measure that risk, right? It's a clinical decision, which there's no numbers involved, right? But with this device, with this headset, we're able to objectively measure what their actual risk is of falling and specifically look at where the problem is, because balance is not a simple problem. Balance has three components. It has your inner ear, it has your vision, and it has your proprioceptors in your feet, and in your body. So there are three axes, there are three ways that your body uses to balance when you stand up and walk. And a problem in any one of these is, could cause a balance problem. So so right now, the way that we assess those three components is not very scientific. I mean, it is scientific, but it's not objective. It doesn't have we don't put a number on it. But with the upright VR headset, we're able to do that. And this is a huge breakthrough because, in the past, 5 different doctors saw the same patient and they would come up with 5 different answers. Now with this headset, there's one answer. And so we're working on this technology, and hopefully it will be ready for use in the next 1 or 2 years. Okay, so what are the benefits of integrative medicine? So I've been talking about this all throughout. Number one is you are addressing the root cause, of the problem. And again, no one is going to disagree that addressing the root cause is the right way to take care of patients. And that's a very big difference than our current health system, which we're treating symptoms. We're popping pills, right? Cost, right? So I've highlighted a few examples of cost, throughout the talk, and it's way cheaper to use an integrative approach. It does take more time, but it's the right way to take care of patients because you're addressing the root cause. And if you're successful with your treatment, the patient is going to be cured, as opposed to giving them a pill where they're never going to be cured, right? They're going to just be on the pill for the rest of their life. And then finally, the quality. Again, the same concept that you're addressing the root cause, the quality of your care is going to go up, right? Because you're curing the patient. That's what they want. Nobody wants to be sick. Nobody wants to have balance problems. Nobody wants to be stressed out. Nobody wants to have a high blood pressure if they can help it, right? I was trained by Dr. Fauci, actually, his book, which is my favorite book, Harrison's book. It's Harrison's Internal Medicine. I'm looking for it on my shelf here. It's here somewhere. In that book, Dr. Fauci wrote that hypertension is an irreversible essential, meaning it's idiopathic, meaning that we don't know the reason for it and you're going to have it forever. And I'm sorry, Dr. Fauci, you're wrong. Hypertension is reversible if you catch it early enough. And things like transcendental meditation, and there are many, many other integrative options that will cure hypertension. Dr. Fauci was my hero up until last year, and I'll talk more about Dr. Fauci next in the next section. But he wrote a wonderful book. His book is fantastic. We all use it. Even today in medical school, people are studying, Harrison's Principles of Internal Medicine. He's the primary author. But these treatments, he didn't include them all. He just included the pharmaceutical treatments. So in terms of quality, I would have much rather learned about transcendental meditation than lisinopril, and lisinopril is a very good drug, right? You need lisinopril sometimes. Sometimes the blood pressure can't be controlled by transcendental meditation or stress reduction or biofeedback, right? So in those cases, you need to use pills, which is totally fine because pills are another option. And while we're talking about this, I'll just mention my father. He doesn't mind me talking about him. He has diabetes, and diabetes is another problem that is reversible if you catch it early enough. You don't have to have diabetes. It takes 10 years to develop diabetes. So if we can catch diabetes in that 10 years, you don't have to have diabetes. And for any of you, I'm sure all of you know someone that's diabetic, or maybe you're diabetic yourself. To me, diabetic is the absolute worst thing you can possibly have, right? Because I love food. And if you tell me that I can't eat a certain food, I'm going to be really mad at you. And as you know, with diabetes, there are, foods that you can't eat, right? So, and diabetes is a condition that affects the entire body, and it has a tremendous amount of burden, health burden, not only on you, but on the health system itself. So treating diabetes is a very, very important thing in America. And we're headed towards 1 in every 3 people having diabetes. And that's primarily because of the way we think about it and the way we treat it. So we don't have a root cause approach to diabetes. A patient develops diabetes, we put them on medications for the rest of their life. And even if they take the medications they also have to change their diet and lifestyle, and we don't do a very good job of explaining how to do that. Some of us have started to use what are called diabetic educators and nutritionists, and are taking a multidisciplinary approach to treating diabetes, and that's a little bit better. But at the end of the day, we're not addressing the root cause. We're treating with pills. We're not focused on the root cause. And an example, and one eye-opening thing about this, and this is another thing that I learned 10 years into my practice, is that the root cause of diabetes is not sugar. The root cause of type 2 diabetes is actually animal fat. And that was a very, very surprising and eye-opening thing for me when I learned it. Now, at that time, I was a double board certified physician, and I didn't know that. So what hope does our population have if our physicians don't know this? In 2020, most of us know this now. It took us about 10 years, and most of us are aware that meat is the root cause of type 2 diabetes. But like I said, this took 10 years for us to learn, and that's unacceptable. We can't have a health system like that. We're not doing the right thing for our patients when we're not teaching our doctors what the root cause is of one of the most common and most serious problems in our health system. So I hope that gives you an idea of the types of complexities and the types of issues that we're facing, what we need to deal with as we move away, from this old system of healthcare to what we need to have, which is an integrative, holistic approach to care. It's much cheaper, it has higher quality, and we're actually curing people and preventing, root causes from turning into disease. So let's see what's next here. Let's go through this, and then I can pause again for some questions if you don't put them in the chat. So challenges. So why don't we already do this? Why are we still doing allopathic care? Why are we still writing pills for everybody? Why are we still telling everybody that they need a vaccine? When there are treatments, for conditions. So number one is awareness. And as I said, I spent a lot of money on my medical education. I did not learn about any of these, zero. And I'll be honest with you, my residency was at a hospital called Hahnemann Hospital. And Dr. Hahnemann is the father of homeopathy. And not one time, I was there for 3 years plus another year as a chief resident, 4 years, not one time did anybody tell me about homeopathy. I'm in Dr. Hahnemann's hospital, but not once did I learn about homeopathy. That was very, very difficult for me to accept later when I realized that that's what happened. So it's just an example of the awareness, that we have very little awareness of what's going on. And then when we go to medical school, that's a big accomplishment for most of us, right? I mean, it's a big deal. And then to finish medical school is a bigger deal. And to be honest with you, we develop egos. Most of us are very competitive. Most of us are working very hard. And when we have these achievements, like we get our medical degree, we get our MD, it feels good, and we're told that, okay, now you can go take care of patients. So we feel like we're ready and that we know the most out of everybody in the population, right, in the society. And that's not unfair. That is something that is natural, that happens. But it's not true. We don't know everything. We only know about allopathic medicine. We don't know about all these other things. And so having that ego makes it very difficult to be open-minded and learn about new things. Yoga, I told you, if you would have told me 10 years ago, I would have said, you're crazy. I'm not doing yoga. Because my awareness was very, very low about anything other than allopathic medicine. And it was the way I was trained. And that brings it to the next point, training, right? So this medical school curriculum has been unchanged since 1950. It's the same curriculum. And we're asking the same questions, right? The answers are a little different, right? And so in 2021, the answer is like in 1950, a patient came in with heart failure, we did bloodletting. Bloodletting is we basically make a hole in somebody's vein and drain their blood, right? And so that reduced their pulmonary edema, which is reduce people's fluid by bleeding, making them bleed. We use leeches, medical leeches, and actually leeches are a very good treatment. We can still use leeches even in 2021. It works and it has lots of evidence. But the only difference between 1950 and 2021 is the treatments. But the way we are diagnosing disease, is that is also different in some ways. But all of our approach to medical problems is unchanged from 1950, and that's a huge problem. We need to fix that. We need to teach our medical students teamwork. We need to teach our medical students about integrative options, non-pharmaceutical options for care. And just to take a little tangent here, why do you think, why is that? Why aren't we teaching, our medical students that? Who runs our medical schools? Our medical schools are run by professors, right? So I'm actually a professor of medicine at Drexel. And most of my colleagues, I don't have any grants, but most of my colleagues have grants. Who is paying for these grants? It's two people, the government, so NIH. So those are very difficult grants to get. And number two, much, much easier, are pharmaceuticals. So the pharmaceutical companies are paying medical school professors lots of money to do studies on all kinds of different, medical problems and their solutions, which are pills. So if the medical schools are run by the pharmaceutical companies, when do you think we're going to learn about transcendental meditation? It's going to be very difficult, right? So you can start to understand the complexity of the system that we have. Okay, so let's say that you're aware and you're also in training. So I deal with a lot of young people, and there are young people now that have known me for 6, 7, 8 years. So they know that I'm an integrative doctor now. And I told them 8 years ago that you better learn about integrative medicine. And they're much smarter than I was. They did learn about it. So now they've graduated from medical school, they've graduated from their residency, and now they have to figure out what they're going to do next. So that's the business model, right? So they can take a job, and as an internist, your starting salary first year in a government job is at least $180,000 minimum. And that's like a 9 to 5 type of job in a clinic, and that's a lot of money, right? That's not easy, right? And they'll get all kinds of benefits, and they'll work from 9 a.m. to 5 p.m. They'll come home and they'll do whatever they want, right? Now contrast that with opening up an integrative medical practice where they, first of all, they don't have any training, right? They graduated residency, but they don't have any training. Now, if they listen to me, maybe they got a little bit of training. So now they have to train for another 1 or 2 years to learn about all the different integrative modalities and the integrative approach. And they have to be out on their own, right? Because there's very few jobs out there that are going to pay you to practice integrative medicine. For the most part, you're going to create your own center. One day there will be lots of centers out there. So you just show up and there's lots of patients there already that need care, and you can deliver the care to them. But the business model of integrative medicine is not easy. The business model of integrative medicine is just like any other business for the most part. Accountants or lawyers or, plumbers or really any other type of service is comparable to the integrative business model. We don't generally accept insurance. We can, insurance will pay, but insurance doesn't pay properly. We see a patient, it takes 90 minutes. The first visit will take 90 minutes or 2 hours, at least an hour minimum. And in our practice, we don't look at our watch. We book the patient, and whether it takes, 90 minutes or 3, we've had a patient that was with us for 3 hours because they were so complex and so many things going on. So it's the same charge. We have the same fee, whether it's 90 minutes or 180 minutes. So that business model is not easy. You have to be pretty savvy, and right out of residency, you're not taking care of these patients because these are very complex patients. These are patients that nobody else has been able to help for the most part. They have very serious medical problems, thyroid conditions, and other hormonal issues, pain syndromes. They have, gut problems and on and on and on. I mean, everything. I mean, from A to Z, from stub toe to, sleeping issues and all kinds of issues. So, it takes an experienced physician that has a very sophisticated approach to their patient to be successful in integrated practice. So again, the business model is a huge challenge. And then finally, the implementation of it. So um, so let's just talk about the hospital. So we actually did a little experiment in our orthopedic unit. So patients were coming out, they got their knee replaced or their hip replaced, and you're going to have some pain. That's normal. It's normal to have pain after a hip replacement or a knee replacement. And some patients, because of the anesthesia, they develop nausea. So we had this idea that, let's give some of these patients ginger. Ginger has been shown, a lot of literature on ginger, that ginger works very well for nausea. There's also another drug called Zofran, which is ondansetron. Ondansetron is very effective for nausea. And I know there are people on this call today that have taken Zofran. They might even have Zofran in their bathroom closet right now. And so Zofran costs, about $5 or $6 per pill. And if you give it IV, it's probably a little bit more than that. It's probably $10, $12 for the IV. A ginger pill costs 2 cents for the pill, right? And so for these knee patients, we did this study, a minor study in our hospital, that we were able to reduce the nausea of a patient that was having, nausea with ginger just as well as using Zofran. And, this was a wonderful study. Everybody was very happy. And so these knee patients, the way we get paid for them is we get something called a DRG. And let's not go too deep into that, but a DRG is basically one payment. The company says you get $5,000 and whatever it costs you to do the procedure is your cost, and whatever is left over you can keep, right? And so what that did was it incentivized us to reduce our cost. So we're going to use cheaper joints. We're going to use ginger instead of Zofran because we're saving a lot of money, and all that money is ours, right? So this was great. So our hospital, we found that ginger works. It's great for nausea. But guess what? We're not using ginger anywhere else in the hospital, just in the orthopedic unit. How does that make any sense? We have the data, we have the evidence. Why aren't we using ginger on the floor? And I know you know the answer. The answer is because we get paid $12 for that IV injection. That takes us 2 seconds to inject, right? And then the pharmaceutical company gets paid, and the insurance company gets paid because they're getting premiums. And so the implementation of an integrative therapy is not easy, especially in a conventional practice, especially in a hospital. And there are political reasons, there are financial reasons, and there are cultural and sociologic reasons too that I'm happy to go into if you're interested. But those reasons are even more difficult than anything that I've already talked about. All right, so let's move on here. Anybody have any questions about anything that I've already mentioned on any of our slides before we go into COVID? I think you guys are getting tired, so I'm going to accelerate the COVID section here, and then if we have some questions after that, we can address them. Herminia, is there anything on the chat? Did I lose you guys, or let's see. There are some chat questions here I can look. Okay. My question is integrative medicine the same as alternative medicine? That's a wonderful question. Yes and no. So alternative medicine in the past was the name that was given to people that use all of these different therapies. It's not wrong. We just have moved away from that name. We like to call it integrative because alternative does not include conventional, right? Allopathic. Alternative is different than allopathic, right? So we like to say integrative because integrative includes allopathic and pharmaceuticals as well. So I don't like to be called an alternative doctor. I like to be called an integrative doctor. Um, Another question here. You mentioned animal fat, but what are the effects of dairy? Right. This is a great
Yeah.
question as well. Were you saying something? Okay. So dairy is another great point. And again, I'm talking about microbiome earlier. Animal fat and the way we treat our animals and the way we are, using animal products is a very, very significant reason for why we have so much disease. And just for example, milk, right? So milk, when I was growing up, milk, it does a body good. That was a very, very famous campaign. It was a commercial on TV. All the Americans on this call will remember that commercial. And we were told that milk is good for you and you should drink it every day and it builds bones and all these benefits. When the fact is that it's absolute wrong. It does not build bones. It actually can leach bones. The amount of evidence now we have on milk and the allergenic effect that it has. So babies that are drinking milk, especially non-organic milk, are having all kinds of immunologic issues, allergies to all kinds of things, peanuts and, all kinds of different fruits. I mean, how do you have an allergy to a fruit, right? I mean, it's pretty amazing. And so dairy is a very, very important reason for why people have serious immunologic problems, including allergies. And so one of the first things that we do in an integrative practice, and again, I didn't know this until we trained in integrative medicine, is that we stop dairy. Anyone that comes in with any kind of an immunologic issue, we stop the dairy, and 50% of the time, that's it. They're done. They're completely better. They're cured, right? Guess what? We address the root cause, right? So, because nobody should be eating dairy, to be honest with you, nobody should be eating it. But for people who have immunologic problems, allergies or otherwise, they stop eating. So we take our fee and then we say, salute, goodbye, and we're
Goodbye.
done. As opposed to in the previous practice, we would do allergy testing. We would put them on allergenic pills. We would see them every 3 months on the pills. How are you doing? They're taking the pill every single day. The pills are not cheap, right? And they're on these pills for the rest of their lives. This is not a little thing. This is a huge deal. So thank you for the question. That is a great example of how integrated practice differs from standard and conventional practice. I don't think there was anything else. Let's see real quick.
Um, yeah, Mr. Ali here is also raising his hand. If you can
Please.
also give his time.
Yeah,
So
please.
you are acknowledged, Sir Ali. Hello, are you there?
Hello.
Yes, hello.
Yeah, so you
How
are,
are you?
yeah.
Hello.
Yeah, we hear you. So you can address your question or any query to our resource speaker.
Thank you for your welcome to me. I'm new. I just joined for this meeting now. I'm so sorry to come late. I was somehow busy, so I'm just excusing you for my coming late. I'm
No,
new.
no
Yeah, it's
problem.
okay. It's okay.
Go ahead. Go ahead,
Yeah,
ask your
go
question.
ahead.
Really, if I cross-check my audio, I would like to ask a question, my brother. We were just debating this title called Universal Care for Africa. Is there any specific issue that we can analyze as a same way, though we are just different situations, different areas, different locations, and
I'm just trying to understand your question. I don't know much about your organization, UCAF.
I'm sorry. Hello?
Yes.
Can you hear me?
Yes, I can. Go
Yeah,
ahead.
we hear you.
Sorry,
We hear you.
yeah, it is right. He on the issue. He's on the issue. Sorry to hear that. So, the issue is all about integrative medicine. So I would like to correct Abdurrahman Ali. So now the issue is beyond that. We analyze it by integrative medicine. If he has question with that topic, maybe we can question misanswer. Sorry that.
Yeah. If I understood correctly, what I'm suggesting is, as you are designing your healthcare system, my suggestion is that you try to exclude pills. Most problems, even in subcontinental Africa, can be handled without pills if we address the root cause. And that is my very strong suggestion, because you're still developing. I mean, your healthcare system is still pretty new. You're still developing it. So you have a wonderful opportunity to have a better health system than we do. If you focus on the root cause. And I think that's probably where I'm hoping I'm answering your question, but that's probably where your opportunity is to don't look at vaccines, don't look at pills as the first option. I mean, I'm not saying you don't need those things. You do need those things, but not as your first option. Your first option should be whatever the root cause of the problem is. And to be honest with you, again, I don't know much about the problems that you're dealing with, but I do know that worldwide, and even in America now, the number one problem is water. Without clean water, it's hopeless. We will never have optimal health. So, and I know you know that. So water to me is the number one factor in developing a great health system. All right, so we're coming up on time here. I want to make sure we keep at least a little bit of time for more questions. So very, very briefly, I'm just going to talk about COVID. And there are some facts here. We know these numbers already. So COVID has a 99.6% survival. We have lots of data that shows this. We know that it affects patients with immune dysfunction. And we talked about immune dysfunction a little bit throughout our talk today. We know that some of the interventions have questionable evidence. So without going into the detail, there's remdesivir, there's plasmapheresis. There are lots of different things that various people have been touting as the answer. But the problem that I have, and the problem that, this has been very frustrating for me, is that we're talking about a vaccine and we're talking about pills to fix COVID, but nobody's addressing the root cause. Who gets COVID? The people that get COVID are sick people that have a poor immune function, right? So when was the last time anybody on our television, or Dr. Fauci specifically, said that we should work on our immune function? Not even once. Not even once. And to be honest with you, it pisses me off. And I'm sorry to be so flippant, but it's very angering. It's very frustrating that we are not talking about the root cause of who gets infected with COVID. And among the people that do get infected with COVID, very, very few of them die. And I know this sounds crass, but the people that die from COVID were the people that were going to die. They were going to die in the next 1 to 2 years. And look, all death is sad. All death is unfortunate, no matter who it is and no matter when it is. But if somebody has terminal cancer or other very serious medical problems and they die because they got COVID, now COVID is not a nice way to die, by the way. I mean, I'm not saying it's good, but this is not unexpected. Most of the people that are dying from COVID were already at very high risk for death in 1 year. And no one is talking about that. We're not talking about it, in formal venues. Our medical leaders, our political leaders, they refuse to address these issues. But for some reason, they are focused on vaccines and less focused on treatments. There are treatments that have been shown to work. Ivermectin is one of them. And there's lots of other things. Vitamin D is another very, very important part of the care that we deliver to these COVID patients. I this week alone, I've admitted myself about 8 patients with COVID, and I've taken care of over 1,000 patients with COVID in the last year. So I have a lot of experience with this. I'm not just talking, out of without any, experience. So my suggestion is that we really look at the root cause of COVID, and that takes an integrative approach. I'm hopeful that this will happen, but there's no sign of it happening anytime soon. So just to wrap up here, and then we can take any questions if there are any. That our modern medicine has come a very long way, and we started in the 40s, and there are many reasons for why we have the system that we have. It's all our fault. We are the reason for the system. It didn't just fall out of the sky, and like it's not random that the way we are taking care of our patients. It's under our control, and that's what is most important about what I'm trying to say here is that it's not like we are afflicted, and that we don't have any control over what's going to happen. This is all under our control, and the food industry is our biggest opportunity to fix it. As well, maybe with the exception of water. Water is another huge opportunity for us to fix the health problems that we're having as a nation. We talked about integrative medicine. We talked about how to define it, all the different modalities, the benefits, the challenges. And I'm hoping that you'll agree that an integrative approach is what we need to do for COVID-19 if we really want to get rid of COVID-19. So at this point, I'll just close and just open it up for any questions or any concerns. I would love for someone to conflict or challenge anything that I've talked about. Those are my favorite questions.
Yeah, so thank you very much. So we have another one. I don't know if I can. I would like to read the question of Dr. Dalia. Ivermectin.
Yeah, I'm
So
reading
what do
it.
you suggest to minimize the effect? Yeah, please.
Yeah,
Thank
so I don't know if
you.
I can get ivermectin.
Ivermectin, yeah.
Unfortunately, Dahlia, you're in trouble. I mean, you need to find somebody that can prescribe this to you. It's a prescription medication. The good news is that there are people that can prescribe it. You just have to find them. And for everybody else on this call, virtual doctors might be the best answer. You can ask them before you have your visit. Will you prescribe ivermectin if it's indicated? If they say no, then you can move on. Just find somebody else that will. So if your primary care doctor is not doing it, or if other people that you already know are not giving you the ivermectin, just keep looking. You will find somebody. Now, the bigger question is, how are you feeling? If you're feeling well and you're not really having symptoms, I wouldn't take ivermectin either, because you're going to be fine. And very likely that you are going to be fine no matter what, right? So if you're having symptoms and you're at high risk for having, serious disease, definitely take ivermectin as possible. It's very easy. I shouldn't tell you this, but I will tell you that some people, because it's available through the veterinary system as well. So if you have a good veterinarian, you might be able to get some ivermectin that way. But you do want to make sure that it's, that whenever you get the veterinary version of the ivermectin is still comparable to the pharmaceutical version. I mean, they're both pharmaceuticals, I guess. I think they are, but again, you have to talk to your veterinarian. In the hospital, we have some patients whose family members are sneaking in the ivermectin because the doctor or the hospital won't give them. I was at a hospital this week that, we had all these COVID patients. Actually, there weren't that many. There were a total of 8, the whole week. And they didn't have ivermectin. It wasn't even on the formulary. It wasn't even available as an option. So their family members, for people that were really sick, that were at risk for dying, there are family members out there that are smuggling ivermectin into the hospital. And I'm not endorsing that process, that approach, but I am telling you that's a lot of people are doing that.
Okay, so thank you very much for elaborating further about the ivermectin. Yeah. So thank you very much. At this point, we have heard so much about integrated medicine. Um, so I would like to raise some questions here. Like, it's notable that you are a clinical professor in Drexel University. So knowing all these gaps now, I call it gaps between the industry and that of the one given in the curriculum in medicine. So there is a gap, very clear gap that this is what's happening in real life situations, but are they being corrected now in the curriculum when students come and they want to end up, being physicians? So how do we get into that, sir?
Yeah, that's a wonderful question. And this
Thank
is
you
part
very
of
much.
the, the issue that we're having. And as I described in my ginger example, right, where we found that ginger works because we're incentivized in that circumstance, right? The insurance company is saying, we're going to pay you one price and it's your job to reduce your cost, right? And so we responded, we reduced our cost. So until the insurance company pays us so that we're incentivized to do the right thing for our patients, it's going to be very difficult, right? Because when you start talking about dollars, you start talking about money. Unfortunately or fortunately, either way, I mean, people just respond. So I need for our doctors of tomorrow, because I'm going to be sick tomorrow, right? I'm getting older, right? We're all going to be sick one day, and I want my doctor to know that ginger is a great remedy for nausea, because I don't want to take Zofran, right? I mean, ginger has no side effects. I love ginger, by the way. I mean, I'm sure all of you that are non-American, I know you use a lot of ginger, abroad. So it's a great treatment for nausea. So the answer to your question, Hermania, is that we just need to incentivize the medical schools. We need to incentivize the hospitals and the physicians to do the right thing for the patient and to be aware, to know that there's other things beyond Zofran. And Zofran is not the only solution for nausea. And so that's very difficult. And the good thing about COVID, the one great thing about COVID that I have to appreciate COVID for is that it has raised awareness of a lot of the things I talked about today. It has raised awareness of the way our physicians are taking care of patients. It has raised awareness of the role of nutrients like vitamin D, for example. And I think it has accelerated our um, vector. It's made us go faster in recognizing that, look, allopathic medicine is not the only medicine that's out there. And I think that is ultimately, gonna get us to where we need to be, because these medical students, they don't know any better, right? I mean, just like I didn't know any better. We trust the medical school to teach us. But I think tomorrow's medical realize that, oh, wait a minute, that was very important, right? Because of the experience. So hopefully they'll start questioning when the professor in the medical school says vitamin D, in during their training, they're going to ask lots more questions, and maybe that'll spur their knowledge in learning about other things as well.
Okay, so thank you very much for the enlightenment along that question, sir. So I would like to also raise the issue about, I was able to put it in a title like the politics of business in medicine.
Yeah,
Okay, so how are you able to address that? Like,
yeah,
you have your group as physicians, so I feel your part as physicians. How are you able to, correct these wrongdoings by politics
yeah.
along medicine? Yeah.
Oh
Thank
wow.
you.
So yeah, so basically you don't want to ever see me again, huh?
Oh,
That I'm playing. So basically, the political issues are extremely difficult, and again, I feel comfortable, but already in this last year, as you know, I'm on LinkedIn, and I have been very disturbed by what's been happening on LinkedIn, Twitter, Facebook, all of these social media platforms. The amount of censorship that has started is extremely concerning. That is absolutely a political issue. And I have had so many of my connections, treasured connections, um, censored and removed, completely removed from LinkedIn. And that has been really disappointing, because if people are not able to express their views, and I'm not saying their views are right, and in my own views, I'm not 100% right. I mean, there are some things I'm definitely right about, but there are many things that I'm sure that I can improve or I'm not saying properly. I need other people to tell me that I'm wrong, and I need the opportunity to tell other people that they're wrong. And this censorship problem that's emerging, this misinformation campaign, is a very serious problem, especially in the United States, because we have a flag that represents freedom. We have a constitution that is the whole philosophy of our country is based on freedom. And censorship is antithetical to our entire reason for having a country. So the politics of medicine is why we have our system. Obamacare, as I said earlier, that was supposed to reduce the spending. At that time, we were spending $3 trillion, and we were supposed to go from 3 trillion to 2 trillion over, 8 to 10 years. So it's 8 to 10 years later, right? So guess how much we spent this last year? We spent 3.8. So instead of going down and up, and now spending if the plan had worked, if Obamacare had worked. Unfortunately, there are lots of political reasons why we're in this space, and if I had those political reasons, you probably wouldn't see me. I probably wouldn't exist. So those are my personal feelings. I would love to be wrong about that, but the censorship issue really is very, very concerning and something that we're going to have to handle first. If we want to get anywhere with health, we cannot afford to have censorship when we're talking about science and medicine and health.
Okay, so thank you very much, sir. So are there questions from our audience? Do you like to raise your queries or
Yeah, you can raise your
any?
hand or you
Yeah,
can
yeah.
use the chat as well, either way. I think I wore
Okay.
everybody out because that was a very
Yeah,
long, that's a
yeah.
lot of bobber in that
Yeah.
2 hours or
Other,
so.
yeah. Otherwise, let me be given another one, please. I was taking down some of the qualities at the outset of your discussion. You mentioned about the qualities that doctors or those who are getting the medicine course should, be mastering with. And I just would like to bring it to personal character. Personal character, I see it as like to to the medicine. I should say the antidote to all this politics in medicine,
Yeah,
or you know. So going back to Drexel University, how from a scale of 1 to 10, 10 is the highest now. So how strong is the emphasis now on character? Because
yeah,
character is something to do with how much money do you want to get while you are still a physician,
yeah,
how much money do you want to invest in the bank. So it all boils down now to how much money you want to get from your course, instead of facilitating life itself. So it's just very disappointing, really, that people would like to go into medicine because of maybe it's a lucrative job. But how are you able to make to emphasize really more on the character part as
yeah.
quality? Yeah, as one
Armenia,
quality of.
you
Yeah.
have the
Thank
answer.
you.
I mean, you have the answer. I mean, I think the undergraduate colleges, and I heard a few years ago, I heard that there was a big push in the Ivy League schools to reduce the amount of emphasis on academic performance and look more at the issue of kindness. And there was a concerted effort, and I believe it's still happening, where people, these Ivy League schools are taking candidates that have kindness on their resume, as opposed to just being great students and having great grades. Grades are definitely important, right? Because without the grades, you can't learn some of these things. But character is absolutely critical. But again, it's a very difficult, very subjective issue, right? So how do
Yeah.
you measure character? And look, I
Uh,
might be a nice guy today, but tomorrow I could be crazy, right? So you're right. I mean, the character of a physician, we inherently expect our physicians to be the best people in our society. We expect them to be the smartest. We expect them to be the most trustworthy. And again, with COVID, I think there's been a huge insult to the physician community because of our medical leaders not giving us the right information. People are not stupid. Just because you don't have a medical degree doesn't mean you can't understand, health. And we have insulted a lot of our population. Many, many Americans are insulted by the way our health leaders have been treating us. And this is a measure of character, right? And to tell the truth, right? I mean, it's one thing, if you don't know the answer, right, and you give the wrong answer, that's one thing. People will forgive you for that. But to lie, about a problem when you know the answer, that's absolutely a character issue, right? And unfortunately, and I'm speaking for myself, I have seen lies from quite a number of medical leaders, throughout this pandemic. And that's, again, if we didn't have, if everybody's character was 100%, I think we would have a very different response to COVID. We'd have a very, very different health system. So you've brought it right up. I mean, I guess at the end of the day is, how do you measure character, right? And once we figure that out, then everything else, I think, will happen by itself.
Okay, so thank you very much, sir, for that answer. So from our audience, do you have any question aside from the one I raised?
I think they're tired, Herminia.
They are tired. Okay,
Yeah.
so so we have given our part. You have given your part, sir, and we are very grateful for this opportunity, this invaluable time from your side, and also bringing along with you your friends who are from the medical field. Before we end our session for this day or tonight, I would like to have the chance for our CEO, Mr. Hans Lum, who is with us now, to say something for our group and also to our resource speaker. So, Sir Hans, you're given the chance now to say something. Thank you.
Sorry, Madam Armenia.
Yes.
Sir Hans, he's out. He's out. He's not present.
Oh, okay.
Sorry that.
Oh, he was here earlier.
Yeah.
Well,
Okay.
Herminia, if you don't mind, I would like to just thank
Yes,
everybody
sir.
for putting
Yes,
up
sir.
with
Yes,
me.
sir. Yes,
And
sir. Yes, sir. Thank you very
I
much.
invite
Yeah.
anyone to use the email here or find me on LinkedIn. I would love to continue the conversation and answer questions and ask. I'll ask a lot of questions too, by the way. And we need everyone to understand what integrative medicine is and how it can help us get to where we want to get to in terms of health of our people. And thank you again for the opportunity to be here today with you all.
Yes, sir. Thank you very much, sir, for your invaluable time, your expertise, and the knowledge that we have gained from you. So we hope that this is not the last for you to be invited in our platform and in our organization. So rest assured, we will pray for you, as we also pray for ourselves, so that all of us will have really good health and we really give justice to the gift of life that God has bestowed to each one of us. We pray for you and your family, sir. So more blessings to come and more help to come on your part, so that you will enlighten more students to become, character-oriented medical practitioners in the future. So thank you very much. We cannot thank you enough for this time, sir, from your side.
Thank
So
you
for us,
again.
yeah.
I can never get enough prayers. So thank you again for those.
Yes, sir. So from our audience, thank you very much for this time also. From the friends and the colleagues of Sir Baber, thank you very much for your time also with us.
Thank
So
you
with
again.
this, we now take off. Thank you very much. Goodbye, everyone. Thank you,
Take
sir.
care. Have a great
Goodbye.
night.
Yes, sir.